I'm Dr. Ann Magner.
Hello, my name is Dr. Amy Rojas.
I am Dr. Ramos.
I chose dentistry. I was originally headed towards medical school. However, I like to work with my hands.
I like to take out teeth. I like to see blood. No. Actually, it's true. I like surgery. You see, that's why I cannot say why I like because I like surgery. I like do surgery.
What do you do when a patient comes to you and he's scared of dentists?
What do I do? Shut up, open your mouth.
Not taking care of myself, depression, bulimia, I guess, I don't know, a lot of bad stuff in my life, I think. And now I'm finally out of it and I need to take care of myself.
I didn't have perfectly straight teeth, but I did not have a gap. Like I had a little gap in between my front teeth. I didn't have that. But then when I got my wisdom teeth taken out, right after that, over the years, my teeth spread. So I want that closed up and want perfect teeth now.
I had some shipyard dental work when I was in the military. Very bad work. And they used caulk for fillings. And of course that deteriorated and I lost some teeth, and over the years my whole jaw structure shifted, causing me to lose my front teeth.
Went to one dentist, and he left me sitting in a chair while he went to the post office. I walked out and never went back again. Then I went to another dentist, and he wouldn't listen to me. You know, he just like, I don't know, I just didn't like the dentist.
I mean, I know people who have gone and who have like gotten really bad infections because, you know, the dentist didn't follow up or didn't give them antibiotics after like a serious oral surgery. I know people who have lost teeth because of it and had to then get implants or didn't go back. And then like, I know people who have like serious dental problems who just don't go.
Very rough. She was doing it very hard and rough, so it was a lot of pain, and I just hated going over there. And I guess I felt too ashamed when I was a child that I used to have like, how to say, cavities. And she was not like good about it. She used to scream at me, make me feel even worse.
Shut up, open your mouth.
So I never liked going over there at all.
When I was younger, I was in a gym class and I had an accident where a kid like head-butted me and it pushed my front tooth all the way back. And the dentist I went to at the time wasn't very good, and he just pushed it back in place and never followed up again with me about it. Just did, you know, regular cleanings and stuff. And then come to find out a few years later, my root died and I had to have a root canal on that tooth. And then they went back in and did a root canal and a filling, and they had to like laser the back of my gum in order to do the filling. And then the tooth got darker and darker, and they actually had to remove the tooth.
The military is a free service, so of course they're not going to take the kind of care that a top-notch professional in, say, in New York would.
I was in the Army, my wisdom teeth were coming in crooked, and they pulled two of them top with no Novocaine. They just pulled them out, and you had to take it, and that was it.
Well, I wouldn't say that that's really a justifiable or an excuse, because they have the knowledge today that there is anesthesia, and these people are in their 40s and their 50s, and their teeth look absolutely horrible.
Usually it has to do with an experience that they had at a particular time in their life, usually childhood, and that stays with them throughout their lifetime. Dental phobia can be easily overcome by going about treatment slowly, explaining to the patient what is going to happen, maybe allowing them to see it in the mirror so they can see the work being done. makes the patient a lot more comfortable.
I think it's just because of that initial start of the procedure where they feel that small pinch and they're very apprehensive. But after once that phase goes by, the patient's mostly always very comfortable.
I get very, very scared. I cry, I scream, my mother has to come with me and hold my hand while the dentist do anything with me because I get very, very scared.
Start doing the easy work first. You know, sometimes they start with simple stuff that sometimes we don't have to use any needles. And eventually, while they get used to you, knowing you, trust you, then you can start adding some more stuff.
Sometimes it did hurt, so I had to put like several. I think at one point I had even 4 one time. And I still just felt uncomfort. I don't know. You know, having your mouth that wide open, always bursting in the sides, and like working in my mouth. It's in the head, so you know, it's not comfortable at all.
So I'm going to give you some anesthesia first, okay? Okay, open your mouth. And just relax, okay? Just relax. Close a little bit, close a little bit, close a little bit. That's it. And that's it. Okay. Now, we get into the lower.
You did a good job.
Wasn't too bad, right?
You did a good job. Usually they're like, I don't know, like in there, like and it hurts, and like open up. Not bad. It's the best one so far that I ever had.
They pulled the wisdom tooth. They had taken a little bit of the jawbone, so I could not get any teeth. There was not enough jawbone, so they had to use my blood and this with this other stuff. I don't know the names of it. And they put it in with a hammer and chisel, a little tiny hammer and chisel, and it was painful. Nothing you can't live with, but it was painful. But now I got teeth back there. I have a jawbone back there that works.
Digital radiography. It's great because, number one, we get our picture very quickly. We know right away whether or not we've gotten an accurate x-ray. It reduces the load of radiation to the patient so that we can take x-rays really whenever we need them without worrying about exposing the patient to excess radiation. And today it really allows us to manipulate the x-ray, to take measurements from the x-ray, just really enables us to see more than we can from our typical radiographic film. We've also come into the age of having dental scans or x-ray machines that can give us three-dimensional x-rays, and they have been brought down to a size that we can utilize in our dental operatories. Previously, a patient would have to go to a radiology center or a hospital in order to have these x-rays taken, and the reality is that they were exposed to more radiation than was really needed from our dental scans. Our dental scans focus primarily on the area of interest for us, which is from the lower jaw to really just below the eyes. But it allows us to see the sinuses. It allows us to reconstruct the jaw in a three-dimensional manner so that we can get an idea of the volume of bone that is present in the jaws. This is particularly important when we're dealing with dental implants, but it can also give us additional information when if patients have certain anomalies, if we're looking for cysts. It shows us if there are problems in the sinuses. So the x-rays have been a great improvement in dentistry in these 30 years since I've been in dentistry.
You can get a baby, an infant who has no teeth, and they can smile and they're very happy. But, you know, as we get older, in society, what people think of us is important. The teeth are a very important part of that, of our physical makeup, and if we look good, then we feel good.
Many patients, when they come to us, they might be missing teeth or want to have certain types of dental care so that they can be in a social environment, so that they can interview for different types of employment. We also find people that psychologically was hindered because they couldn't smile. But now we find that many of these patients, after being restored, you can see a change in just how their self-esteem is for themselves. What we really tried to do at this institution is make implant dentistry affordable to our patients.
After the dentist is done preparing the tooth, they would then image the preparation onto the computer monitor by the use of an intraoral camera. Once the image of the tooth is on the computer monitor, they would then be able to design the different parameters of the filling, how tall it is, how wide it is, how thick it would be, the shape of the restoration on the computer through the software program. Once the dentist has defined the outer parameters of that restoration, then the machine would mill that restoration in 3 dimensions out of the ceramic block material. And what's nice about the CAD/CAM technique is it allows us to use the porcelain in a more conservative nature at the chair, similar to what you would do with a composite resin. So it gives the patient another alternative for a very nice-looking, long-lasting restoration.
We did the bone graft, which was extremely painful, and then before I started the process for the implant, I decided to get the braces so that my teeth will be straight once the implant is in.
My teeth were all gone. They were rotted away from smoking. You know, I never drank, but I smoked a lot, heavy. And once I got started, it was long, it was painful, but the rewards are out of this world.
Take care of your teeth. I always tell, like, to kids that I see, to my husband's son, I always tell him, don't eat too much candy, look at these teeth. You don't want to have teeth like this, so take care of your teeth. It's best to have your own, but now I'm not fortunate to have my own, so I have to do something about it.
It was well worth it in the long run.